So the ibrutinib definitely has been the first BTK inhibitor used in the mantle cell lymphoma in the relapse setting, and it has been tested in the first-line treatment in the prospective randomized clinical trials. The SHINE study was positive in terms of the PFS, but the ibrutinib was not approved based on this study for the first-line treatment. The situation is slightly different in the younger patients because we in the European Mantle Cell Lymphoma Network run the triangle study. So we combined the intensive treatment, rituximab CHOP, alternating with the DHAP stem cell transplant and the rituximab maintenance versus the same regimen with ibrutinib, or versus the same regimen and we skip the stem cell transplant, high-dose therapy consolidation. And in all experimental arms, ibrutinib was used as a maintenance. And the study was definitely positive in terms of the progression-free survival, respectively in terms of the event-free survival. And it seemed that we can safely skip the stem cell transplant. So for the younger population, it seemed that, at least in Europe, the combination of the ibrutinib with the intensive regimen and the ibrutinib maintenance together with rituximab became a new standard for the treatment. Definitely there are new BTK inhibitors, the second generation, the acalabrutinib study is positive, so we are expecting that the acalabrutinib will be used in the first-line treatment, and for the patients who are failing the zanubrutinib, or if the patients are failing as a group of the BTK covalent inhibitor, the Pirtobrutinib could place. The data with the Pirtobrutinib is quite encouraging. So when we compare the results to the CAR T-cell therapy, to the Brexucell treatment, is not so much worse, and it's definitely off-shelf therapy. So I think that the BTK inhibitors has definitely the future. The other issue is if we can skip the chemotherapy, so it means if we can combine BTK inhibitor plus, for instance, venetoclax BCL inhibitor. So, and definitely this study has been demonstrated superiority of the for the relapse refractory patients, superiority of the combination ibrutinib plus venetoclax compared to the ibrutinib. So this is something we are moving now in the mantle cell lymphoma.